Welcome to PMHNP 101 review session. Whether you're preparing for the board exam or reinforcing key psychiatric nursing knowledge, today's session will guide you through 10 high-yield questions with rationales. We'll not only review the correct answers, but also explain why the other choices are incorrect. Don't rush. Feel free to pause the audio and ensure you're comfortable with your choice before continuing. All right, let's dive right into the first question. Question 1. A 30-year-old female with a history of major depressive disorder presents with significant weight gain and excessive sleepiness. Which antidepressant is least likely to exacerbate these symptoms? A. Mirtazapine, B. Paroxetine, C. Bupropion, D. Fluoxetine. Correct answer, C. Bupropion. So bupropion is an atypical antidepressant that is less likely to cause weight gain or sedation. Unlike medications that affect serotonin or histamine receptors, bupropion works mainly on dopamine and norepinephrine, making it more activating and less associated with weight gain. Let's take a look at why the other options are incorrect. A. Mirtazapine is known for causing significant weight gain and sedation due to its strong antihistamine effects. B. Paroxetine is a sedating SSRI that commonly causes weight gain and fatigue, making it unsuitable for patients with concerns about these side effects. D. Fluoxetine. Although less sedating than paroxetine, fluoxetine can still cause weight gain in some individuals due to its long-term effects on appetite and metabolism. Question 2. A 25-year-old male reports difficulty sleeping and frequent nightmares after returning from military deployment. What is the most likely diagnosis? A. Generalized anxiety disorder. B. Major depressive disorder. C. Acute stress disorder. D. Post-traumatic stress disorder, PTSD. Correct answer, D. Post-traumatic stress disorder, PTSD. PTSD involves symptoms such as nightmares, flashbacks, hyperarousal, and avoidance behaviors after exposure to a traumatic event like military deployment. Here's why the other options are incorrect. A. Generalized anxiety disorder. While it causes persistent worry, it does not typically include nightmares or trauma-specific symptoms. B. Major depressive disorder. Depression may involve sleep disturbances, but nightmares related to trauma are not characteristic. C. Acute stress disorder, similar to PTSD, but diagnosed within 1 month of the traumatic event. Since this case suggests a more chronic timeline, PTSD is the appropriate diagnosis. Liking this content? Don't forget to hit that subscribe button and join our PMHNP 101 study family on YouTube, Facebook, and Patreon. Moving forward, we'll dive into the next question. Question 3. A 42-year-old male with bipolar disorder is started on lithium. What is the most important lab test to monitor during treatment? A. Liver function tests. B. Kidney function tests. C. Thyroid function tests. D. Blood glucose levels. Correct answer, B. Kidney function tests. So lithium is primarily excreted through the kidneys, and long-term use can lead to nephrotoxicity, making kidney monitoring essential to prevent complications. Here's why the other options are incorrect. A. Liver function tests. Lithium does not typically affect liver function. C. Thyroid function tests. While thyroid monitoring is also important, it is not the most critical, as renal impairment poses a greater risk. D. Blood glucose levels. Lithium does not directly affect glucose metabolism. Question 4. A 29-year-old female presents with symptoms of irritability, fatigue, and mood swings that occur in the luteal phase of her menstrual cycle. What is the most likely diagnosis? A. Major depressive disorder. B. Bipolar disorder. C. Premenstrual dysphoric disorder, PMDD. D. Generalized anxiety disorder. Correct answer, C. Premenstrual dysphoric disorder, PMDD. PMDD involves severe mood swings, irritability, and physical symptoms during the luteal phase of the menstrual cycle, significantly affecting daily life. So why are the other options incorrect? A. Major depressive disorder, persistent, not cyclic, and not tied to the menstrual cycle. B. Bipolar disorder. Mood episodes are not typically tied to the menstrual cycle. Generalized anxiety disorder. anxiety in GAD is more constant and not linked to menstrual phases. Next up, question 5. A 50-year-old female with a history of schizophrenia reports auditory hallucinations and is currently on clozapine. What should be regularly monitored due to the risk of a granulocytosis? A. Platelet count. B. White blood cell count. C. Hemoglobin levels. D. Serum electrolytes. Correct answer B. White blood cell count. Clozapine is associated with a granulocytosis, dangerously low WBC count, making regular WBC monitoring critical for patient safety. Let's take a look at why the other options are incorrect. A. Platelet count, not directly affected by clozapine. C. Hemoglobin levels, not related to a granulocytosis. D. Serum electrolytes. Clozapine does not significantly impact electrolyte balance. Remember, success on the PMHNP board exam isn't just about memorizing facts. It's about truly understanding the material and applying it to real clinical scenarios. Let's do question 6. A 60-year-old male with a history of Parkinson's disease is prescribed carbidopa-levodopa. Which of the following side effects is most likely to occur with this medication? A. Hyperprolactinemia. B. Orthostatic hypotension. C. Weight gain. D. Bradykinesia. Correct answer, B. Orthostatic hypotension. Carbidopa-levodopa commonly causes orthostatic hypotension due to its effects on blood pressure regulation through dopaminergic pathways. Now here's why the other options are incorrect. A. Hyperprolactinemia, more commonly seen with antipsychotics, not Parkinson's treatment. C. Weight gain, uncommon with carbidopa-levodopa. D. Bradykinesia. Carbidopa-levodopa typically alleviates rather than causes bradykinesia. Here we go. Question 7. A 40-year-old female with depression is started on fluoxetine. After 1 week, she reports increased anxiety and agitation. What is the most likely explanation? A. Adverse reaction to fluoxetine. B. Serotonin syndrome. C. Early side effect of SSRI. Development of bipolar disorder. Correct answer, C. Early side effect of SSRI. So SSRIs can cause initial anxiety and agitation as serotonin levels fluctuate before stabilizing. This is often temporary and improves with time. Now let's see why the other options are incorrect. A. Adverse reaction to fluoxetine. Anxiety and agitation are expected early side effects, not a severe adverse reaction. B. Serotonin syndrome usually presents with hyperreflexia, confusion, and autonomic instability, not just anxiety. D. Development of bipolar disorder. Although possible, the timeline suggests the anxiety is likely an SSRI-related side effect rather than hypomania. Help us reach more PsychNP students. Like, comment, and share this video. All right, so question 8. A 70-year-old male presents with memory loss and difficulty performing daily activities. His family reports that his cognitive decline has been gradual. What is the most likely diagnosis? A. Delirium. B. Major depressive disorder. C. Vascular dementia. D. Alzheimer's disease. Correct answer D. Alzheimer's disease. Gradual memory decline, disorientation, and impaired daily functioning are hallmarks of Alzheimer's disease. You are wondering why the other options are incorrect. Well, delirium presents with acute onset and fluctuating symptoms, often reversible. B. Major depressive disorder can cause pseudo-dementia, but cognitive symptoms typically improve with mood stabilization. C. Vascular dementia often presents with a more stepwise decline due to strokes. Let's move to question 9. A 35-year-old male with a history of major depressive disorder is prescribed bupropion. Which of the following is a contraindication for this medication? A. Obesity. B. History of seizures. C. Nicotine dependence. D. Seasonal affective disorder. Correct answer, B. History of seizures. Bupropion lowers the seizure threshold, making it contraindicated for patients with a seizure history. Here's why the other options are incorrect. A. Obesity. Bupropion is often used for weight management in patients with depression. C. Nicotine dependence. Bupropion, as Zaban, is commonly prescribed to aid in smoking cessation. D. Seasonal affective disorder. It is a preferred treatment option for this condition. Question 10. A 50-year-old female with a history of generalized anxiety disorder presents with muscle tension and difficulty concentrating. Which of the following medications is best suited for her long-term management? A. Alprazolam, Xanax. B. Buspirone, Buspar. C. Clonazepam, Clonopin. D. Propranolol, Inderal. Correct answer, B. Buspirone, Buspar. Buspirone is effective for long-term management of generalized anxiety disorder without the risk of dependence associated with benzodiazepines. Here's why the other options are incorrect. A. Alprazolam, Xanax. Short-term use is common, but long-term use risks dependence and withdrawal. C. Clonazepam, Clonopin. While it is used for anxiety, it carries the same long-term dependence risks as alprazolam. D. Propranolol, Inderal. More effective for situational anxiety, e.g. performance anxiety, than chronic generalized anxiety disorder. Great job making it to the end of today's review session. Take some time to review the rationales and revisit the questions you found tricky. You're on the right path, and I can't wait to see you in the next session.